Hello and welcome. Today, we're diving into a complex neurological disorder called Guillain-Barré syndrome, often abbreviated as GBS. This rare condition causes rapid onset muscle weakness and even paralysis, affecting people of all ages. We'll explore what GBS is, what causes it, and what treatments are available. The exact cause of Guillain-Barré syndrome remains a mystery, but it's most often triggered by a preceding infection. About 2/3 of people with GBS report experiencing a bacterial or viral infection in the weeks before symptoms begin. Common culprits include Campylobacter jejuni, a bacterium often linked to food poisoning, as well as viruses like cytomegalovirus, Epstein-Barr virus, Zika virus, and even influenza. In rare cases, surgery or vaccination have been associated with the onset of GBS. However, it's crucial to remember that these triggers don't always lead to GBS, and scientists are still working to understand the specific mechanisms involved. Guillain-Barré syndrome is an autoimmune disorder, meaning the body's immune system mistakenly attacks its own nerves. Specifically, the immune system targets the myelin sheath, a protective coating that surrounds nerve fibers and allows them to transmit signals efficiently. When the myelin sheath is damaged, nerve signals are slowed or blocked altogether. This process, called demyelination, disrupts communication between the brain and the muscles, leading to weakness and eventual paralysis. In severe cases, the immune system can also attack the nerve axon itself, leading to more permanent damage. Guillain-Barré syndrome is considered a rare disease. Estimates vary, but it's believed to affect roughly 1 to 2 people per 100,000 each year. While it can occur at any age, it's slightly more common in older adults. GBS affects all ethnic and racial groups equally, and it's slightly more prevalent in males than females. Though outbreaks can occur following specific infections, GBS isn't generally considered contagious. The symptoms of Guillain-Barré syndrome can develop rapidly, often progressing over days or weeks. The most common initial symptom is weakness and tingling in the feet and legs. This weakness then typically spreads to the upper body and arms. Other symptoms can include difficulty walking, severe pain that may be cramping or shooting in nature, difficulty with eye movement, facial movement, speaking, chewing, or swallowing, double vision, loss of bladder or bowel control, and difficulty breathing. Because GBS can affect breathing muscles, it's essential to seek immediate medical attention if you experience any of these symptoms. Diagnosing Guillain-Barré syndrome involves a thorough neurological examination and medical history review. Doctors often perform a lumbar puncture, also known as a spinal tap, to analyze the cerebrospinal fluid surrounding the brain and spinal cord. In GBS, this fluid often shows elevated protein levels but a normal white blood cell count. Nerve conduction studies and electromyography, or EMG, are also crucial for diagnosis. These tests measure the electrical activity of nerves and muscles, helping to identify nerve damage and dysfunction characteristic of GBS. While there are variations, the most common types of Guillain-Barré syndrome include acute inflammatory demyelinating polyneuropathy (AIDP), which is the most prevalent form in North America and Europe. ADP primarily targets the myelin sheath. Acute motor axonal neuropathy (AMN) and acute motor and sensory axonal neuropathy (MSN) are less common and involve direct damage to the nerve axons themselves. Miller-Fisher syndrome is another variant characterized by paralysis of eye muscles, unsteadiness, and loss of reflexes. The classification helps doctors understand the specific mechanisms involved and tailor treatment accordingly. There is no cure for Guillain-Barré syndrome, but treatments can help to reduce the severity of the illness and speed up recovery. 2 primary treatments are used. Plasma exchange, also known as plasmapheresis, involves removing antibodies from the blood that are attacking the nerves. Intravenous immunoglobulin, or AVIG, involves infusing healthy antibodies from donors to help block the harmful antibodies in the patient's blood. Supportive care is also crucial, including monitoring vital signs like heart rate and breathing, providing respiratory support if needed, and managing pain. Physical therapy and occupational therapy play a vital role in helping patients regain strength and mobility as they recover. Unfortunately, there's no specific way to prevent Guillain-Barré syndrome, given that the exact causes are complex and often linked to common infections. Practicing good hygiene, such as frequent hand washing, can help to reduce the risk of infections that may trigger GBS. Staying up to date on recommended vaccinations, including flu shots, may also provide some protection, although the association between vaccines and GBS is rare and complex. It's important to discuss any concerns about vaccination with your healthcare provider. The prognosis for Guillain-Barré syndrome varies. Most people eventually recover, but some may experience long-term weakness or other neurological deficits. Recovery can take weeks, months, or even years. Approximately 80% of people with GBS are able to walk independently within 6 months of diagnosis. However, around 5–10% of individuals may experience chronic GBS, and about 5% may die, often due to complications such as respiratory failure or cardiac arrest. Research continues to focus on understanding the underlying mechanisms of GBS, identifying new biomarkers for early diagnosis, and developing more targeted therapies to improve outcomes. Recent advances include exploring the role of specific antibodies in different GBS subtypes and investigating novel immunomodulatory treatments. Ongoing research holds promise for more effective treatments and improved quality of life for individuals affected by Guillain-Barré syndrome.